What we're seeing now, I think, is what I would call healthcare 3.0, where we're trying to move away from episodes of care to thinking about healthcare delivery as a continuous but still system-driven process. So now, instead of us wanting to have that child with hypoplastic left heart syndrome survive to be able to be discharged home from that episode of care, now what we're concerned about is getting them into University of Toronto, Queen's College, and having them develop into well-adjusted, productive, healthy adults. That's a very different issue that requires now stringing care together across many venues, across time, across specialty, and paying attention to many different facets of their health care. And what we're seeing, if we look around the world, is the provision of care getting organized into what I'd call networks or value networks that are really creating a much greater continuum. And one of the big challenges there is, if I go back to this notion of specialization, which allows this great stuff to happen, specialization also creates a great deal of fragmentation. It tends to be become very concentrated and have to address the needs of a broad population, but most of the care that a child will receive over their childhood is not going to be in the hospital where those specialized services exist. It's no different in the adult healthcare world. I'm using pediatric experiences, but it's no different if you're an adult with heart disease or diabetes or chronic obstructive pulmonary disease or cancer. Same issues, same dynamics apply. And so now we're starting to really look at governance at a regional level or at a network level, and that's a different story. If I think about the future, so I'd say a lot of the developed world right now is stuck somewhere between what I'd call Hospital 2.0, still focused on episodes, and Hospital 3.0, healthcare as a continuous system-driven process. Where I think we're trying to get to is what I'd call healthcare 4.0, which is healthcare delivery as a patient-driven continuous activity. And you think about the experience now with commercial travel as an example. We've moved from the stagecoach, which was probably the equivalent of the healthcare 1.0 experience, to now needing really complicated systems to fly airplanes across the country, to now having very consumer-directed procurement of commercial transportation services through Expedia and Travelocity and things where people are now knitting together all the components of their travel experience and doing it in a very self-directed way. And in that version, the system is truly organized around the individual. There's really no tolerance for the hierarchy between organizations. Organizations provide more or less commodity services. But if you think about the coordination of services now across a continuum, you require a much different set of systems that where the governance begins to become necessary at a more societal or industry-wide level through standards, through regulations that make it possible for people to come in and facilitate the navigation of people, patients, families, information across a very distributed network in a way that can be very self-directed. And if I kind of think of what that means, for example, in the children's heart surgery, it would be a family knowing that they have a child with a diagnosis that needs to be addressed and being able to seek out the very best provider for each of the different components, regardless of what network those providers belong to, and to be able to assemble that team in a fairly seamless way and move information between them in a way that also is seamless.